So Blastic Plasmacytoid Dendritic cell neoplasm, or BPDCN, is a rare, really even an ultra-rare blood cancer that I specialize in. And patients with this cancer have often had a very misunderstood and difficult journey, and so that's one of my missions in my career and really in my life, is to educate folks about these rare diseases, because after all, at the end of the day, if you have a rare disease, or it's your mother, your spouse, your partner, your brother or sister, it's not rare. It's a disease. It's something that you have to face. And so I'm proud to report to you that we've made, my group and I, several major breakthroughs in just the last few years. But I think the two to highlight for patients with BPDCN is that, one, the majority of these patients will have a shortened life expectancy. And so we believe early diagnosis intervention can help, and then in the young patients, allogeneic stem cell transplant. But the majority of our patients are either older, unfit, they may never go to a transplant, and so we are looking for what you would call an urgent unmet medical need, and we've had some success with breakthroughs with CD123 targeted therapy, which is present in 100% of these patients. I'm proud to say that I led the pivotal trial that ultimately led to FDA approval with an agent known as Tagraxofusp, which is the first-in-class CD123 targeted agent and also the first drug ever approved for BPDCN. What's great is not only we showed those original results in the New England Journal of Medicine in 2019, but we also followed that up with a recent 3-year long-term follow-up paper, which was just published last month in 2022, showing that in that frontline treated group of patients, that 65 patients, there's still a 75% overall response rate with a 57% complete remission, what we call CR/CRc rate. And again, so that shows that there is some long-term benefit to the CD123 targeted approach. We're now working with multiple other next-generation CD123 drugs, such as the IMGN 632, Pivekimab, Sunirine, which is an ongoing frontline clinical trial. So I think the field is a very exciting one for our patients and caregivers, lots of research, lots of folks that we're collaborating with all around the world in our consortium and our BPDCN network. So I'm very excited about the future for our patients.